when we did tests on his blood, his oxygen levels were very, very low, and he actually in fact required a mask put over his face to try and blow air down, and unfortunately even intubation. Hello everyone, and welcome back to my YouTube channel. Welcome back to another episode. You're joining me on another shift at the front line, and I'm going to hopefully give you a bit more of an insight into what's going on at the moment. Clearly things are developing day by day, week by week, and I want to keep giving you an insight. I am joined first of all by the lovely Dr Alison, who we've been on shift today basically, haven't we? Already a few hours.
Nearly finished.
We're actually nearly finished. So it's been a busy shift, hasn't it?
It has, of course, and mostly the patients, because we've been in the major part of the hospital and resus. Nearly all of our patients have been probable corona patients.
We've seen quite a lot today, and actually we've seen quite a lot of unwell patients today, haven't we?
We have, and we've seen some patients that we wouldn't normally see being so unwell.
Yeah.
We were talking earlier about the age ranges. Today has been quite a few what we would regard as younger patients, under 50s, coming in, quite seriously unwell and needing to be in the hospital, who've become unwell quite quickly, and that can be quite disturbing.
It can, of course, be a bit of a shock to see patients that are young and unwell, but actually a lot of people will do very well with this that we never see, right?
Absolutely. I think we're seeing very much the tip of the iceberg. I think we're seeing sort of 1-2% of everybody that's actually sick, and that's how it should be. Even with the normal flu season, we see very few people in the hospital that need to be in the hospital, and as I say, most people recover, most people do very well, but they need to look after themselves properly at home.
And recover well at home. And I've got to ask your opinion, are we at the peak or are we still climbing at the moment?
I think we're still climbing. The way it's been today, the way it's been over the past week or so, it's a different profile of people that are coming in, I think. Because I do think that people do get to sort of a week to 10 days and aren't improving at home, so are coming in to us quite rightly to make sure that everything is going to get better. I can't see it really slowing down in the next week.
I think it's going to be getting busier for several weeks. I think the peak's yet to come. Of course, they're opening the NHS Nightingale, other centres to cope with this, but we are really, I think, at the beginning of the climb now. Really.
And I think in London we get a very different picture to the rest of the country.
And the rest of the country probably will follow on the trend.
I would imagine so. But there's so many people, and we travel so extensively, and of course, commuting, etc. So it's lovely if people are able to stay at home, to look after each other at home, even if you're all well.
London is ahead of the curve, there's no doubt about that, and I think the rest of the country will follow. Alison, thank you so much. Let's go and finish the last couple of hours of our shift. We're powering through, we're getting this done. Right, I'll catch you with the guys in a bit. So as you guys saw, I spoke to Alison a little bit earlier. The shift has gone by, and I've been in resus for the majority of that, wearing the full PPE. I don't know if you can see any of the marks, but I've had a mask on over there. Quite uncomfortable. When you're wearing the mask, when you're breathing, it makes your nose run. It just feels really odd to breathe through the mask. And the visor as well can mist up, which makes things practically a little bit difficult. But it's important to look after ourselves. Wearing PPE is very important, and we take it very, very serious. Something I wanted to talk to you about today is the mental health impact of coronavirus. I've seen a few patients over the last few shifts who are potentially vulnerable patients, those with learning difficulties, others with Down syndromes, who have the infection, and they're coming and they're very afraid because we're wearing these masks, we're wearing what is quite intimidating gear, and it's that effect on the patients that makes them afraid, worried. One patient with learning difficulties was really scared of us and scared of what we were doing, which is really upsetting for us as staff. We're trying to help, of course, but we completely understand how overwhelming it must be, even for those without learning difficulties. If you're in resus and you're surrounded by all these people with masks and goggles, it's going to be intimidating. And a case I saw with a 40-year-old learning difficulties was really traumatized by the experience. It just highlights the importance of making sure we're thinking about the mental health of these patients. I always try and introduce myself and say, look, I know I'm wearing all this stuff, but I'm still human, I'm still looking after you, don't be afraid. It can have a huge impact. And I do worry about all those in the community who are afraid to come to the hospital because of and understandably because of COVID-19, but might be suffering. So, please do speak to your GP, speak to your mental health services, make sure you get the support you need. We don't want people to be at home and afraid. I know that if you do come in, we'll do our very best for you always. One case I'm going to talk to you about, a case I saw in resus. You know, I've said to you guys before, we are seeing patients that are young and well, and I want to tell you about this case. So a gentleman in his late 40s, 50s, who presents with shortness of breath, cough and fever for about 7 days, very, very short of breath at home today. Came to the hospital, very low oxygen saturations, so measurements on his finger, a high heart rate and a high fever as well. When we did tests on his blood, his oxygen levels are very, very low, and he actually in fact required a mask put over his face to try and blow air down, and unfortunately even intubation. It of course makes you feel really upset to see someone that's so young and fit and well, who actually, you know, has a very normal job, looks after himself, doesn't smoke, be so unwell. But at the same time, of course, we do know that there's a percentage of the population who are fit and well but be unwell. And my main message for you guys is keep an eye on your symptoms. Of course, self-isolate and stay at home. But if your breathlessness is getting worse, you know, you're very short of breath, even on walking, you know, minimal distances. If your fever is very high and not controlled, if you're feeling just really weak and unwell, just speak to 111, talk to us and let us know so that we can get and help you early before things get too bad. Of course we want people to self-isolate, and for the majority of people they can stay at home and manage their symptoms without ever speaking to us. But if you are feeling worried, if you're feeling unwell, make that phone call, because we do want to hear from you. And for those who are unwell and need our help, we are here to help you. So that's just some advice from me. You know, as I say, it's really upsetting to see young people that are unwell. We're seeing quite a few that need our help. But the majority of those people who are unwell, who are young and fit, will recover well at home. I know a question a lot of you are asking is, well, how, if there's some young people who get it and they're not unwell and other people are really well, why is that? How is that the case? Well, an example I'd use, and obviously this isn't, you know, directly, you know, the same, but it's an example, is the flu. You know, you might have 100 people, young people, having the flu and have, you know, moderate illness, be able to manage at home. But every now and then, someone with the flu can be very, very unwell, as we know. And even every year, some young people do die with the flu. And I'd use that same example, that not everyone's the same. Every individual is different and will respond differently to illness and differently to treatments as well. And that's part of the reason. Also, sometimes genetic makeup as well. Some people respond in different ways, as I say, to the virus. And there's also some thought and belief around viral load. So if you have a lot of virus in your system from the start, that might make you more unwell than if you're exposed maybe to a very low dose. And that's part of the theory why some NHS staff who are exposed to, you know, a lot of the virus, maybe in ENT and anaesthetics, you know, in A&E and ITU, that might be why those staff are becoming more unwell. Just to make a point about morale at the moment, of course, there was a passing of a nurse and several doctors who I've talked about and on social media. Of course it affects us. We're one big team here, one big family, and the death of anyone is obviously going to cause a lot of distress across the workforce and the nation. But we're keeping strong, keeping our heads up, and we'll keep fighting. So thanks for your support. So my shift is now finished and I'm just heading home. It's been, as I said, again, a busy shift. I know I keep saying that, but it's the truth. I'm feeling all right. I'm tired. One of the things that's challenging is I'm away from my girlfriend, so I made the decision that I didn't want to risk giving it to her or her family, and so I'm up in London, staying on my own, isolating in a sense. So she is, you know, staying elsewhere so that I don't give it to her. But that's difficult, you know, when you have a busy shift like today, you want to go home and, you know, sit and chat to someone and just hang out with someone just to kind of relax after what's happened. It's kind of hard when you just can't do that and you're on your own. But, you know, technology is good. Having the ability to FaceTime and chat to people, call the family and stuff, it does help. I try and make sure I share as much of my experience as I can because, yeah, it does help. And even doing these videos as well, like telling you guys how I feel, what I'm doing, what I'm seeing, you know, it does help me get through what is a challenging time, especially, you know, hearing deaths amongst young colleagues, young people that we're seeing. So yeah, it's not easy mentally, but I'm keeping exercising, I'm keeping busy, trying to look after myself and eat well. I know that it's quite likely that over the next few weeks we're going to find out more about how long we're going to be in isolation for. I think that will be a significant period of time, potentially another 3 to 4 weeks extended. Depends what you know, the Prime Minister and the team of Public Health kind of decide. So we'll find out more about that, I guess, in the coming days. Another point is we're keeping an eye on these figures. I know people are worried about the death rates going up and up, but we know and have expected that. It's really, really sad, and every death is, you know, a loss. But we are not surprised to see some of these figures because we were expecting them, and that's why the lockdown is so important. I hope this episode has been useful. I hope I've given you a good insight into what's going on, how I'm feeling, what I'm seeing on the front line. thanks to everyone who's commenting such kind things and being so supportive. You're all amazing and it really makes a difference. So thank you so much. Comment your further thoughts below and any questions you have. Take care, guys. Bye.